professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, I am Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. In this video, I'm going to quickly go over some brief overview of creating a map, and what I'm really going to show you here is how mapping can be used to understand local level issues and needs that are there within the county, and then the ability to address these needs. So let me show you a little bit about how I created this map. I took a little bit of time to arrange the categories, so I'm going to show you what I've done. So first of all, for starters, this is the cloud-based ArcGIS software, and on top here, as it states, the County Health Rankings 2021, and I named this with local information, and you'll soon see why. So a lot of this information actually comes from a nationally representative dataset known as BRFSS. And the color coordination and the color coding that you see is light purple represents people with actually the percentage of individuals with more poor mental health days. So if it's light purple, then people had more poor mental health days in the last month, whereas dark purple means less poor mental health days. So what I encourage you to do is take a couple of counties and take a look what is going on as a snapshot at the county level, and that is the power that I'm going to show you in this neat little exercise. So let's hone in on a major city. Let's look at Atlanta for starters. And we zoomed in on Butts County. This is in metropolitan Atlanta, and there's quite a few indicators here, and I named them different county indicators. So the first one that you see is the percentage of adults ages 25 to 44 with some post-secondary education, and that is 37.4. And as you can see, I already told you light purple means more mental health, poor mental health days. So kind of looking at where the county is in terms of not only looking at age and post-secondary education, but also looking at flu vaccination rates, and then also percentage of adults with poor physical health in the last month. So I'm going to share the link to this map, and I encourage you to go through this list and take a look at some of the percentages. And what you should do is really, like for instance, if you're looking at metropolitan Atlanta, take a look at several counties. So just click on over. And so there's Butts County, but then Rockdale County is a little bit different. So just looking at the first percentage, there's only 37.4% with post-secondary education, whereas in neighboring Rockdale County there's 58.7%. So you can see there's disparities already, even within neighboring counties. And that is the whole point of understanding social determinants at the local level, how zip code makes such a big difference. That is the biggest indicator of understanding not only educational variables, but other types of access related questions that we're really trying to address. So again, looking at vaccinations rates, flu vaccination rates, again, with COVID and in the post-pandemic world, we really have to be paying attention to flu vaccination rates. And what I've done is actually stratified that by ethnicity. So in Rockdale County, there's not really that much of a difference between the different ethnicities and vaccination rates. Actually, looking at the white population, 52% flu vaccinations rates, whereas in black population, 38%. So there is, in fact, a disparity in vaccination rates. And these are the types of questions we try to understand and address. What types of access-related issues, perhaps patient-physician relationship, what all is going on to create these disparities. And so we can look in neighboring counties and see if these disparities still exist. And as you see in Butts County, white flu vaccination percentage 48%, whereas in black percentage is 26%. So there's a lot of work to be done, and this will reflect in other types of disparities. So this is just a snapshot of one of such types of disparities. So as you can see, we've already gathered quite a bit of information by comparing various counties and understanding local level information and getting a quick snapshot. It doesn't take very long to create these maps, and again, the center for this, the central focus was areas with mental health need. So I explored areas that had high mental health need and low mental health need, and it's good to do a kind of a cursory look, a qualitative snapshot understanding, and then look into the numeric comparisons. So you can zoom out here a bit and then explore some other types of relationships in different sections of the country. You can also compare between East Coast and West Coast, compare counties like that. So I hope this has given you some clue as to how you can further explore future unique research topics in the area of social determinants and any type of social research. Thank you for listening.